This is what's known as an ankle-controlled articular rotation, where we're isolating our ankle to go through the most range of motion that I have available to me without compensating through other regions and utilizing my knee for more movement or utilizing my hip or shifting my body weight side to side to pretend I have more range. We're just trying to groove this joint and give our brain some feedback to that region and stimulate some blood flow and healthy nutrients to get to this joint as we are preparing to make our body move into deeper ranges of motion, or just as a daily movement practice to be healthy for our joints. So key component, moving slow, moving very controlled, and staying within our limits of what we can actually move our ankle in. The time allotted for a drill like this is typically 1 to 2 minutes. The more we move and the more slowly we move methodically and stimulate the tissues around, the better. This is a drill that is not going to harm you. It is a very safe drill to be performing. So I'll isolate my leg, just hook it up, or I can do this seated on a chair, but I need my foot elevated off the ground. So we're going to pay attention to my foot down here and what my ankle is doing, and then also that I'm not going to be shifting my leg around. I'll start by pointing my toe and my ankle down towards the ground. So I'm not going to actually like bend my toes down. I'm keeping them relatively pretty still, but I'm just letting my toes guide the motion. So I'm pressing down on like the gas pedal. So I'll start here. I'm going to start to slowly make my ankle move down and around, then up towards my face, and then I slowly open up towards the side. When I get to the side here, I'm squeezing the muscles on the outside here, and I'm not trying to feel a pinching sensation right at the ankle joint as I go down and back around to the starting point. Once I made it to the starting point, I'm going to reverse it. Nice and slow and controlled, getting the tissues on the right side of my ankle stimulated. As I'm going up, I'm getting the top part of my ankle stimulated. Maybe the front of my shin will be felt. That is perfect. As I go down and in, I'll start to notice that my calf wants to start kicking in. My heel is going to go up towards the backside of my ankle as my foot points down, and then I made it back around to the starting point. Then I'd reverse again because my timer is going, and I'm trying to do this nice and slow and controlled for roughly 1 to 2 minutes straight, and then back around again.